Your knees don't just hurt out of nowhere. There's actually a reason why they flare up worse at certain times of day. And in the next 2 minutes, I'm going to give you a fix you can do right now, sitting exactly where you are. Then I'm going to walk you through what's actually driving the inflammation underneath it, because if you only treat the pain and ignore what's feeding it, you're going to be right back here again next week, and then the week after that. And honestly, that's the trap most people get stuck in for years, sometimes decades. So let's start with what's really happening inside that joint. Your knee is a hinge, but it's a hinge that's cushioned by cartilage, lubricated by something called synovial fluid, and surrounded by a joint capsule that's packed with nerve endings. When that cartilage wears down, or when your body is running a low-grade inflammatory state, the space between the bones gets tighter, the fluid gets thicker, and every step sends a signal straight to your brain that something's wrong. That's the ache you feel. That's the stiffness. That's the grinding or clicking you might notice when you go upstairs or stand up from a chair. Now here's the part most people don't realize. Knee pain is almost always worse after periods of stillness. Sitting in a car for an hour, sitting through a movie, even a long night's sleep. Why? Because motion is what keeps that synovial fluid circulating. Think of it like oil in an engine. When the engine's running, the oil moves and everything's smooth. When the engine sits for hours, that oil settles and thickens. And the first few minutes after you start it back up, everything feels sluggish and stiff. Your knee works almost exactly the same way. So the fix isn't only about strength, though strength matters a lot. It's about getting that fluid moving again in a very specific, very gentle sequence. Let me show you. Here's your 2-minute routine, and I want you to actually do this with me right now, wherever you're sitting or lying down. First, straighten one leg out in front of you, as straight as you comfortably can, and hold it for 5 seconds. You should feel the muscle on the top of your thigh, your quadricep, tighten up. Then relax completely. Do that 5 times on each leg. This is called a quad set, and it does something really important. It pumps fluid through the joint capsule, and it activates the muscle that protects your knee from the front. A weak quad is one of the biggest predictors of knee pain in the research, because that muscle is basically your knee's built-in shock absorber, and most people over 60 have lost a noticeable amount of quad strength without even realizing it, simply from sitting more over the years. After that, you're going to do ankle circles. Lift one foot slightly off the ground and rotate your ankle in slow circles. 10 in one direction, 10 in the other, then switch feet. This feels like it has nothing to do with your knee, but it actually does. It gets circulation moving up the entire leg, and it wakes up the smaller stabilizer muscles that support your knee from the sides, the ones almost everybody completely ignores until they get injured. Then, the last piece of the routine. Gently bend and straighten your knee, sliding your heel toward you and then back out, about 10 times per leg, nice and slow, never forcing it. This is called a heel slide, and what it's doing is coaxing that thick, sluggish synovial fluid to redistribute evenly across the joint surface, almost like kneading dough so it's smooth everywhere instead of clumped in one spot. By the time you finish all 3 of these, most people notice an immediate difference. Not a cure, I want to be honest with you, but real, noticeable relief, because you physically helped that joint do what it's been starving to do. I want you to do this little sequence first thing when you wake up, before you even swing your legs out of bed, and again anytime you've been sitting for a long stretch. 2 minutes. That's genuinely all it takes, and it costs you nothing. Now, if you want a little more, here's a bonus 4th move you can add once the first 3 feel easy. It's called a seated knee extension with a hold. Sitting in a sturdy chair, straighten one leg out until it's parallel to the floor. Hold it for a full 10 seconds, then lower it slowly, really slowly, over a count of 4. That slow lowering part is called an eccentric contraction, and research on tendon and joint rehab consistently shows that slow, controlled lowering builds strength and resilience in the tissue faster than the lifting part alone. Do this 5 times per leg, and you've essentially turned your 2-minute routine into a real strengthening session without ever leaving your chair. While we're on the topic of stretches, I want to give you 2 more that pair really well with this routine, especially if you tend to feel tightness behind the knee or in the calf. The first is a simple seated hamstring stretch. Extend one leg out, keep your back straight, and gently hinge forward from your hips, not your lower back, until you feel a mild stretch behind your thigh. Hold that for 20 to 30 seconds. Don't bounce, just breathe through it. Tight hamstrings pull on the back of the knee joint and can genuinely change the way your kneecap tracks when you walk. The second is a calf stretch against a wall, 1 foot back, heel pressed into the floor, leaning forward until you feel a gentle pull in your lower leg. Tight calves change your walking gait more than people expect, and that altered gait often shows up as extra strain on the knee. But here's the thing, that routine handles the symptom. It does not fix why the inflammation is there in the first place. So let's talk about the root cause, because this is where most people get stuck, spending years managing pain instead of actually resolving it. Inflammation in the knee doesn't start in the knee. Most of the time, it starts with what's going on inside your body more broadly. One of the biggest drivers is excess weight. And I don't say that to make anyone feel bad. I say it because the math is honestly shocking. Every extra pound you carry adds roughly 4 pounds of pressure on your knees with every single step because of the way your body's leverage works when you walk. That means losing even 10 pounds can take 40 pounds of pressure off that joint with every stride. Multiply that across the thousands of steps you take in a day, and you start to understand why weight is one of the single biggest levers for knee pain relief, bigger than almost any supplement or cream on the market. The second driver is blood sugar. When your blood sugar runs high over time, it creates something called advanced glycation end products, or AGEs for short. These are basically sugar molecules that attach themselves to proteins in your body, including the collagen in your cartilage, and they make that tissue stiffer, more brittle, and more prone to breaking down. This is part of why people with poorly controlled blood sugar tend to have worse joint pain, independent of their weight entirely. So cutting back on refined carbohydrates and sugary snacks isn't just about your waistline. It's about protecting the actual structural integrity of your joints at the molecular level. The third driver, and this one genuinely surprises people, is your gut. There's a growing body of research connecting gut health to inflammatory joint conditions. When the lining of your gut is compromised, sometimes called increased intestinal permeability or leaky gut, it can allow inflammatory compounds into your bloodstream that circulate throughout your body and settle in your joints, your knees included. This is one of the reasons a diet high in processed food and low in fiber tends to correlate with worse inflammatory symptoms almost everywhere in the body, not just the digestive tract itself. There's a fourth driver too, one that connects back to that engine analogy from earlier, and that's your circadian rhythm. Cortisol, your body's natural anti-inflammatory hormone, runs on a daily cycle. It's highest in the morning and lowest in the middle of the night. And inflammatory activity in the body tends to move in the opposite direction, rising while cortisol is low. That's part of why joint stiffness is often worst first thing in the morning. Your body's natural anti-inflammatory hormone hasn't ramped up yet. Poor sleep disrupts this rhythm even further, which is why people who sleep badly for weeks at a time often report their joint pain getting noticeably worse, even if nothing physically changed in the knee itself. I also want to touch on the difference between osteoarthritis and rheumatoid arthritis, because a lot of people use these terms interchangeably, and they are genuinely different conditions. Osteoarthritis is what's usually called wear and tear arthritis, where cartilage gradually breaks down over years of use, injury, or excess load on the joint. It tends to get worse with activity and better with rest, though too much rest brings back that stiffness we talked about earlier. Rheumatoid arthritis is different. It's an autoimmune condition, meaning your immune system is mistakenly attacking your own joint tissue. It often causes more prolonged morning stiffness, sometimes lasting an hour or more, and it frequently affects joints on both sides of the body symmetrically. If your stiffness regularly lasts longer than 30 to 45 minutes in the morning, or if you're noticing swelling in multiple joints at once, that's worth bringing up with your doctor, because rheumatoid arthritis benefits from a different treatment approach than osteoarthritis does. Now let's clear up a few things people get wrong, because there's a lot of misinformation floating around about knee pain. One common myth is that cracking or popping sounds in your knee mean something is badly damaged. In most cases, that sound is just gas bubbles releasing in the joint fluid, completely harmless, unless it's paired with actual pain or swelling. Another myth is that you should rest a stiff knee completely until it feels better. In reality, gentle movement is almost always more helpful than total rest, because rest is exactly what thickens that synovial fluid and makes the stiffness worse, not better. A third myth is that knee pain is simply something you have to accept as part of getting older, that there's nothing to be done besides live with it. But cartilage health is influenced by inflammation, blood sugar, weight, and movement patterns, all things you actually have real control over. So nothing to be done is rarely the accurate picture. And one more, people often assume that any exercise is bad for a painful knee, so they avoid movement altogether. But the right kind of low-impact movement, the kind we've been talking about, is one of the most protective things you can do for the joint long term. Now let's talk about what actually helps calm this inflammation down from the inside, because there are a few things backed by real research that consistently show up when you look at the studies. Curcumin, which is the active compound in turmeric, has been studied fairly extensively for joint pain, and several clinical trials have found it can reduce pain and stiffness in people with osteoarthritis, in some cases performing comparably to over-the-counter anti-inflammatory medication, but without the same stomach and kidney side effects that come with long-term use of those drugs. The catch is, your body doesn't absorb curcumin very well on its own, So look for a supplement that includes black pepper extract or piperine, which dramatically increases how much your body can actually use. Omega-3 fatty acids, the kind found in fish oil, are another one worth mentioning. Research has shown they can help reduce the inflammatory markers circulating in your blood, and some studies on osteoarthritis patients have found modest but real improvements in pain and joint function with consistent use over several months. If you don't eat fatty fish like salmon or sardines a couple times a week, a fish oil supplement is a reasonable way to fill that gap. Vitamin D is worth checking too, not loading up on massive doses on your own, but actually getting your levels tested, because deficiency is extremely common, especially if you don't get much sun exposure, and low vitamin D has been associated with increased joint pain and slower recovery from inflammation. If your doctor finds you're low, they can recommend an appropriate dose specifically for you, since the right amount genuinely varies from person to person based on your levels and other health factors. Magnesium deserves a mention here too, because it's one of the most overlooked minerals when it comes to joint and muscle health. It plays a role in relaxing muscles around the joint and supporting normal nerve function, and a lot of older adults run low on it without knowing, partly because certain medications and reduced dietary intake can lower magnesium levels over time. Leafy greens, nuts, and seeds are good dietary sources, and if you're prone to muscle cramps at night, that's sometimes a sign worth mentioning to your doctor. Boswellia, sometimes called Indian frankincense, is another one that shows up repeatedly in joint health research. Several studies have found it can reduce pain and improve function in people with knee osteoarthritis within just a few weeks of consistent use. And it appears to work through a different inflammatory pathway than curcumin does, which is why some people combine the two. And then there's collagen. Your cartilage is largely built from collagen, and some studies suggest that taking a collagen peptide supplement can support the body's ability to maintain and repair that cartilage over time. It's not an overnight fix. These things tend to take 8 to 12 weeks of consistent use before people notice a real difference. But for a lot of people, it becomes a worthwhile long-term addition to their routine. Beyond supplements, I want to mention food, because what's on your plate every day matters just as much, if not more. Foods that tend to fuel inflammation include fried foods, sugary drinks, refined white bread and pastries, and processed meats. On the other side, foods that tend to calm inflammation down include fatty fish, leafy greens, berries, nuts, olive oil, and colorful vegetables in general. You don't need a perfect diet, nobody has one, but shifting the ratio even slightly in favor of whole foods over processed ones tends to show up in how your joints feel within just a few weeks. Hydration matters here too, more than people expect. Synovial fluid is mostly water, and chronic mild dehydration, which is extremely common in older adults because thirst signals weaken with age, can contribute to that fluid becoming thicker and less effective at cushioning the joint. Aim for consistent water intake throughout the day rather than large amounts all at once. And if plain water is hard to get down, herbal tea or water with a splash of fruit counts too. I want to pause here because there's something bigger going on that ties all of this together, and it's something almost nobody talks about. Your body doesn't run on one single system. It runs on a whole network of signals. Your blood sugar, your inflammation levels, your sleep quality, your hormone balance, your gut function, all of them talking to each other constantly. When one of those signals is off, it doesn't just affect that one area, it ripples through everything else, including your joints. You can do every single exercise, take every single supplement, and still feel stuck if the actual signal that's driving your inflammation never gets addressed. That's the piece most people miss because they're treating the knee like it's an isolated problem, when really it's often a downstream symptom of something happening elsewhere in the body. Now let's get back to the practical side, because movement really is one of the most powerful tools you have. And I want to give you a few more specific things you can layer on top of that 2-minute routine. Strengthening your quadriceps is, hands down, one of the most well-supported interventions for knee pain in the research. A stronger quad means better shock absorption, better joint stability, and less direct load on the cartilage itself. One of the simplest ways to build this is the sit-to-stand exercise. If you're sitting at a desk or in a chair for long periods, stand up and sit back down slowly, with control, as many times as you comfortably can. If you can only do it 2 or 3 times at first, that's completely fine. That's your starting point, and it will improve faster than you expect. Build from there. Doing this every hour throughout the day adds up to a significant amount of strengthening work without ever feeling like a formal workout. Wall sits are another one worth trying. Lean your back against a wall, slide down until your knees are at roughly a right angle, and hold that position for as long as you can, working your way up over time, even if that's only 10 or 15 seconds at first. This builds endurance in the exact muscles that stabilize your knee, and you'll feel it working within seconds. Step-ups are a great addition once the basics feel comfortable. Using the bottom step of a staircase or a sturdy low platform, step up with one leg, bring the other up to meet it, then step back down slowly. This mimics real everyday movement, going upstairs, getting out of a car, and builds functional strength that directly translates to less pain during those exact activities. Walking is still one of the best overall things you can do, but the surface and pace matter more than people think. Walking on a flat, even surface at a comfortable pace is far gentler on the joint than walking on uneven terrain or pushing through pain on hills. If you have access to a pool, walking in water is even better because the buoyancy takes a huge amount of pressure off the joint while you're still building strength and mobility, which is why so many physical therapy programs use water-based exercise for knee patients specifically. One thing I'll also mention, because it's simple and often overlooked, is your footwear. Worn-out shoes with no support left in them change the way force travels up through your leg and into your knee with every step. If your shoes are more than a year or two old and the tread is visibly worn down, that alone could be contributing more to your knee pain than you'd expect, and replacing them is one of the cheapest interventions available to you. Let's talk about ice and heat for a second because people mix this up all the time. Heat is generally better before activity because it loosens the joint and improves blood flow, which is why a warm shower or a heating pad before your morning routine can make a real difference. Ice is generally better after activity or after a flare-up because it helps reduce swelling and calm down acute inflammation. 15 to 20 minutes is typically enough. More than that, and you risk irritating the skin without adding extra benefit. Sleep position matters too, more than most people realize. If you sleep on your back, placing a pillow underneath your knees can reduce strain on the joint overnight. If you sleep on your side, placing a pillow between your knees keeps your hips and knees aligned instead of letting the top leg pull your whole joint out of position for hours at a time. Small change, but it adds up over a full night's sleep every single night for years. A couple of everyday habits are worth adjusting too. When you get in and out of a car, try leading with your body weight through your hips and glutes rather than twisting through your knee. And use the door frame for support if you need it. When you go downstairs, the descent actually puts more stress on the knee than climbing up does. So take it slow, use the handrail, and if one knee is worse than the other, lead down with that leg first, so the stronger leg is doing the controlling work. I also want to mention something that surprises a lot of people, which is that knee pain isn't always about the knee itself. Sometimes it's actually coming from an imbalance further up or down the chain. Tight hips, weak glutes, or even issues with your feet and ankles that change how force travels through your leg. If you've done everything right and you're still not seeing improvement, it might be worth having a physical therapist assess your entire movement pattern, not just the knee in isolation. Because sometimes the real problem is one joint away from where you actually feel the pain. Now before you go, I do want to be upfront with you. If your knee pain came on suddenly, if it's accompanied by significant swelling, redness, warmth, or fever, or if you're having trouble bearing weight on it at all, those are signs you should get it checked out by a doctor rather than trying to manage it at home. Because those can be signs of something like an infection or a more serious injury that needs direct medical attention right away. Everything I've shared here is general information based on how joint inflammation typically works, not a diagnosis or a replacement for a conversation with your own doctor, especially if you're on medications or managing another condition, since some supplements can interact with blood thinners or other prescriptions. But for the everyday stiffness, the achiness that shows up after sitting too long, the pain that flares first thing in the morning, that 2-minute routine combined with these root cause changes is genuinely one of the most effective, low-cost things you can do, and the research backs it up again and again. Small, consistent action beats an expensive quick fix almost every single time, and your knees will tell you the difference within just a couple of weeks. If this helped you, there's a lot more happening in your body that's connected to inflammation that most people never hear about, and I break it down in detail in another video that I think you're going to want to watch next.